Hello, everybody. Welcome back. This is the Psychedelics Today News Roundup with Jack and Joe. How you doing today, Jack?
I am good, Joe. Happy Monday. Excited to get
Happy
into it.
Monday. Yeah, it's going to be good. We got a couple
Yeah.
good news items to get into today and give some high kicks. But what are the two big topics you're going to want to jump into today?
I'm definitely excited to break down some of the latest state policy developments, Vermont, Missouri, Maryland, and I think a slight update on federal policy is in order.
Great. Yeah. Since we did this, I think it was on Friday, we did our last one. It's been some news. Robert Gallery, football player, got some headlines on psychedelics for CTE and depression. That was kind of nice. Compass continues to get solid attention, I think, and even a pickup in The Economist. Some interesting articles at Psychiatric Times about adverse events in psychedelics, which Emory University is doing some adverse psychedelic event research
Yeah.
right now. So if you want to participate, you can check that out at emory.edu, or just check out our emails. We have some links there.
Yeah, and I believe Emory also recently started accepting applications for participants in one of the first active duty military studies with psychedelics. And just a quick shout out, I think Dr. Roman Politsky down at Emory is one of the most important thought leaders, even though I kind of hate that term, in both evaluating and really digging into what negative or adverse psychedelic experiences might do to the mind, and how we can actually measure the intensity of adverse psychedelic experiences. Had the opportunity to listen to him at Harvard last year. I think he's just a really brilliant guy, and would encourage folks to read anything that he's published.
Yeah,
Yeah.
I have a outstanding email. Sorry, I haven't gotten back to you, Dr.
So
Politsky.
many.
Hopefully later today. But yeah, I really want to help them. Their center is just so great.
So
Um,
great.
yeah, and I know some of the people that helped on that recent military project, and it's pretty awesome. New headline over at SciPost: Ibogaine appears to trigger an accelerated auto psychotherapy process during PTSD treatment. Interesting. Related
Yeah.
to a lot of our conversations. Um, what else? There's this commentary on Colorado having a chance to get ibogaine policy right. I think Joshua White from Fireside wrote that one.
Mhm.
Yeah, and there's all sorts of interesting activity in Colorado right now. I'm sure you saw I think we even named it, some of this kind of Compass Pathways Comp 360 type legislation is in the Colorado State House, and we don't really know if it's going to affect the NMHA rules around legalization and decriminalization yet, but we need to stay on top of that. And Compass,
Yeah.
we do want to stay friends. so let's go easy on NMHA so we can stay friends.
Yeah.
And then what else is going on in the news from High Kicks? There's been some interesting stuff around the Kukion, the Eleusinian Mysteries elixir, people thinking they finally understand the pathways. Got some calls coming up on that one. The pathways through which it was synthesized. So that'll be interesting. I think
There
that's
was
it from
a
High Kicks. Yeah.
there was a really cool, I want to shout out the Cannabis Law Report, which does a
Hmm.
really great job of scouring the headlines and finding things that I'm not even aware of as a reporter covering these issues. Believe the government of Spain held a pretty cool hearing on the science of psychedelic assisted therapies last week. And I know that Spain was the Spanish chapter of the Psychedelic Care EU initiative was incredibly active. And there's just a lot of support. So it's really cool to see that. I don't think that that's a parliamentary system, but the Spanish government over in Spain is taking a hard look at the viability of psychedelic assisted therapies.
I love that. That's really excellent. And final thing, Cambridge University Press, an assessment put out this one on the 14th, linking multi-receptor affinities to remyelination and metabolic restoration. So a lot of really interesting stuff there around repairing nerve function and restoring metabolic function after ibogaine. And I had a friend
Very
on
cool.
Friday evening tell me that she'd kind of like perpetually bad vision and kind of like cross-eyed naturally after I became like a lot of vision just restored. Fascinating case studies like this
Wow.
keep happening, and Dr. Andy Weil always says like, "Oh yeah, mushrooms, and I didn't need glasses anymore." I'm like, yeah, I don't know, maybe, but
Yeah,
all this stuff needs more research. So
for sure.
yeah. All right, so let's dig into our big first one, reunion. What's going on there?
Yeah, well, Reunion Therapeutics, which has been working on a novel compound, I think it is
A reunion neuroscience, maybe?
Reunion Neuroscience. Yes, believe it's the levetiracetam, has been designated by the FDA as a breakthrough therapy for treating postpartum depression. I believe it is the first psychedelic compound to receive that designation to treat a specifically women's health related health issue like postpartum depression, which is very difficult to treat, as we know. And I think it signals a growing interest from the field in treating specifically women's health issues with psychedelics. It is one of the fastest growing topics of interest in the movement. And we talked on Friday about concerns that there might be following the midterms this year or something of a backlash against the MAHA Make America Healthy Again movement, especially when it comes to conservative Republican support for said movement. I really believe that the intersection of women's health and psychedelics, both research but also as an advocacy talking point, can stymie potential left-leaning blowback against the MAHA movement. We're living under an administration that doesn't think too highly of women or women's health issues, and there's a very clear political in for those on the left who are supportive of psychedelics to not lose the thread at the broad spectrum of conditions that they can treat.
Right. So this is a chronic issue in science funding in general. Is women's health gets really, really bad funding historically. This is not a new issue in the last 4 or
Yeah.
even 2 years. This is like many decades or maybe forever research problem. When you look at the proportion of NIH funds dedicated to women's health research, particularly, it's tragically low. So, what we actually know from a scientific perspective around women's health is just tragic. And
Yeah.
we really do need to allocate more funds there. But what we have here is a great signal in the FDA that this treatment might be coming sooner than later. What does it say here? Phase 3 trials in 2026, which is awesome. I want to read Melissa Lavasani's quote. I think she's doing some support over there. This was in her LinkedIn this morning. Encouraging to see continued clinical progress in areas of profound unmet need like postpartum depression. Breakthrough therapy designation by the FDA signals not just promise in a single therapeutic approach, but a broader shift toward rapidly acting evidence-driven treatments for conditions where timing is critical. At the system level, milestones like this reinforce the importance of building the infrastructure now. Clinical readiness provides education and care delivery models so that emerging therapies can responsibly integrate into mainstream healthcare if and when approved. For mothers and families, innovation must ultimately translate into safe, accessible care. Progress along rigorous regulatory pathways is how we get there. So, she kind of very famously had some issues. She's very public about it after her second child came, and this is definitely in alignment with her whole story. So check out her story if you don't know it. Really important activist in DC, both for federal and local policy. Um,
Definitely. Yeah.
yeah,
And there are groups in the underground or this semi-underground, especially in advocacy spaces, that are working really hard to address the gap in understanding and knowledge and public awareness of the efficacy of psychedelics to treat women's health issues. I want to shout out the Deva Collective, which I think does a really phenomenal job, and one of their founders, Melissa Whippo. I also want to shout out Stephanie Carzon Abrams, who works neuropharmacologist, I think one of the preeminent minds in this particular subsection of research, and has created a pretty unique treatment protocol called Galilea that is designed to actually treat women with, I think, particularly ketamine-assisted therapy for a bevy of issues, but has been thoughtfully crafted in terms of protocol and standards so that other psychedelic or psychedelic adjacent modalities might be utilized through said protocol. Wrote a little bit about that for Double Blind Magazine a couple of weeks ago. Would really encourage folks to check that out. But again, I think this is one of those areas that we're not talking nearly enough about when we go to the halls of power and talk about applications for psychedelic-assisted therapies and treating very severe health and mental health crises. And I think we've only scratched the surface.
So before we go from Reunion here, the drug that Reunion has worked on is 4-HO-DIPT, and that's quite interesting. I think there's do you know anything about this drug?
I admittedly do not. Haven't been
4-OH,
focused most.
sorry,
Yeah.
4-OH-DIPT.
Okay, so 4-OH, like the kratom, one of the synthetic,
I don't
one of the alkaloids present in kratom. Am I wrong? That's 7-OH.
but I don't think that's a tryptamine, right? That's more of an opioid in kratom. So this is like a short-acting tryptamine, I believe. And I think that is one of the leading things supporting this drug at Reunion, is that it's a shorter lived experience. So we don't have to go through the full, 3 to 80 hour kind of psychedelic thing.
Yeah.
And I think that's interesting. I don't even see a reference for 4-OH on Psychonaut Wiki. So this is looks like a fairly novel molecule. If we're looking at 4-HO-DIPT, it is somewhat characterized. So anyway, 4-HO-DIPT might be something similar to a psilocin. So anyway, that's enough for now. We don't have to speculate on it without any clear data, but just wanted to name the drug.
Exciting stuff.
Yeah, they're calling it luvsalocin. Luvsalocin.
Luvsalocin.
Yeah. Cool. Anyway, what's next?
Well, there's definitely been some interesting action at the state level when it comes to policy reform. And one state in particular I'd like for folks to continue to keep an eye on is Maryland. As last year, a psychedelic task force was established with a lot of really brilliant names attached. And they generated a pretty interesting report that outlines some very progressive recommendations to the Maryland state legislature regarding possible rollout of the legalization of psilocybin in some capacity. A lot of people were really excited about it. A lot of people felt like this was, a step towards a much more progressive and thoughtful legislation this term. And yet, much to the outrage of activists across the state in Maryland and serious stakeholders involved on grassroots level, the Maryland state legislature seemed to have just punted. They have since, it broke this morning that the Maryland House and Senate have approved a bill that would simply extend the task force for another year and ask them to make some more serious and more detailed recommendations as to how these things might, psilocybin legalization might be implemented. But the consensus on the ground from advocacy stakeholders who really wanted to see more is that this is, again, little more than punting down the line. It's worth noting that Governor Wes Moore is planning to run for re-election. Does this seem like the kind of thing that a governor would stake their reputation on signing into law in an election year? I'm not so sure. I'm working on an article for Lucid News in partnership with Psychedelic States of America about the entire fiasco. And I think this is part of a broader trend in kind of task force focused legislation we've seen filed in Massachusetts and North Carolina. And that not only is it mostly just a, I guess, symbolic action rather than something that the legislature in any of those states is actually required to follow the recommendations, let alone is the governor expected to endorse or support. But also, there's a pretty concerning trend in which, for example, in North Carolina, a veterans task force was established to assess and evaluate the implementation of psychedelics and treating veteran mental health issues. And yet there aren't very many veterans on that task force. Same thing up in Massachusetts. There's a lot of activists affiliated with veteran organizations that aren't actually military veterans. And I know that there's a growing frustration surrounding task force focused legislation in particular. We have pretty ample evidence from Colorado and Oregon that public health harms are not increased when legalizing psychedelics in some capacity. And again, I think the task force is a little more than lip service, from my understanding. And down the line, Missouri had a really, really fascinating set of hearings last week. There's a really well put together coalition in Missouri, led in part by the Modern Health Coalition and some of the folks at Psychedelic Missouri that, worth noting, successfully enacted the first bill that utilized opioid settlement funds given to the state from the federal government to fund psilocybin-focused research. I believe it was a small pilot program for veterans with PTSD and treatment-resistant depression. Now, with the rise of Ibogaine popularity in conservative circles, from my understanding, there's been a lot of debate, and there have been a couple of Ibogaine-focused bills introduced. There's been a lot of debate over whether or not sticking with psilocybin is the right call, given the momentum Ibogaine has generated. We'll get to how maybe Ibogaine is going to lose some momentum in the near future based on some shoddy alliances formed by prominent advocacy groups. But I do think that Missouri is one of the most exciting states where policy is likely to be moved forward at a pretty rapid pace, either this year or next. I'm excited to interview the folks at the Modern Health Coalition in Psychedelic Missouri in the near future. But again, I think it's really cool, the bipartisan coalition that's cropped up there that seems to be really focused on enacting thoughtful policy in a meaningful way. And then a quick pivot to Vermont, where we talked a little bit earlier about Compass Pathways designs on state level policy reform. Vermont for Ibogaine, led in part by a very charismatic state legislator named Brian Cena, as well as the good folks at the Psychedelic Society of Vermont and Dr. Rick Barnett, who I think is one of the sharpest minds in the field, have really been working to build inroads across the legislature to support some funding for Ibogaine research and a pivot. Notably, Vermont had a task force of their own a few years ago that actually recommended not moving forward on any substantive psilocybin legalization or decriminalization reform, which at the time, Dr. Barnett was pretty outspoken in being disappointed by as a member of that task force. So the pivot to Ibogaine and a research-focused model seems to make sense based on the climate and temperature of that particular state political climate right now. And yet Compass Pathways has swooped in as of late, from my understanding, as covered last week by Jane Hu and the Microdose, put together by UC Berkeley, and tried to get some trigger bills filed of their own in regards to their synthetic crystal polymorph psilocybin compound, Comp 360. So some warring, or maybe not warring, might be a bit dramatic, but some conflicted parties certainly raising the alarm about what Compass Pathways' large dollar spend on lobbying might do to meaningful and thoughtful homegrown advocacy up in Vermont.
Outstanding. Well, this is interesting. I want to rewind the tape a little bit back to Reunion, because we're looking at this molecule 4-OH, DIPT is what they're reporting. Luve psilocin, LUVE psilocin is what they're calling it. Very different from psilocin in that would be 4-HODMT, dimethyltryptamine. So different. DIPT would be more of a dipropyltryptamine. Dipropyltryptamine generally was used in a lot of clinical trial research in the greater Maryland area, back when Groff was kind of quite active in the early days of American psychedelic research in the Northeast. So anyway, just wanted to clarify that point in case anybody was a little confused. And the letter order, I believe, matters in molecules. So 4-OH would be different from 4-HO, best I can tell. So anyway, there's wiki articles on these drugs if you wanted to learn more. Feel free to dig in if you're feeling like a drug nerd today. And Missouri, it's fascinating that we're getting action there. I didn't expect it. I'm really happy to hear it. It's a veteran heavy state, so I think there would be some activity. And this kind of comes full circle, this postpartum conversation, the veterans conversation, conservative conversation, where we see a lot of support in a lot of conservative circles around Ibogaine. And I wonder if in part it's because, I think Brian Hubbard says this, and maybe Logan Davidson as well, that it hasn't been ever caught up in hippie culture or drug war culture. So, and it's known to not be all that pleasurable.
Yeah.
You know, we like to suffer here. So we like drugs that are kind of a little bit more difficult, but also have high reward, right? So um, I think that's interesting. And I hope for some movement with psilocybin and other tryptamines because we kind of have better established safety data with tryptamines. Um, but anyway, the women's health issue from the beginning, I think, needs to start matching the veteran focus that we have here because there's probably more women than there are veterans, right? And women have a lot of issues. And I think we we can lead with, issues for moms and the elderly, and not just purely lead with the veterans topic because that's been kind of the activist focus for so long. I think we need to diversify a little bit. Um, yeah. Any thoughts there, Jack?
I definitely have, having taken the temperature uh, of activists across the country. Nobody's against supporting veterans or trying to help veterans heal, but there is as we kind of talked about on last Friday, a growing frustration over the minimization of alternative voices and alternative narratives, many of which you think about 50% of the population are affected. 1 in 4 women, I think 1 in 4 or 1 in 3 women experience some form of sexual trauma in their lives, in their lifetimes. These are much larger swaths of our population than simply the veteran population in the States. And that's not to knock the importance by any means. But there is a growing appetite for alternative narratives. Another one I think worth keeping an eye on is the viability of psychedelics in treating autoimmune disorders and neuroinflammatory conditions, which is a vastly understudied, but I think increasingly important area to address in the growing sickliness of the American populace at large. I think it's like 1 in 5 Americans suffer from an autoimmune disorder now or a chronic health condition.
Hmm. Hmm.
And we don't really have any real solutions. So I definitely see that there's an appetite to diversify the narratives and the talking points in which we're reaching legislators at across all factions. Um, yeah,
So yeah, the autoimmune thing and the inflammation thing is super interesting. The DEA cases that SSDP and others were working on, I think Hamilton Morris was there. You were there covering it. Robert Rush was
yeah,
there. um, DOI is one of the molecules that we're working to get scheduled, and these molecules are showing great promise for treating inflammation, systemic inflammation at sub-perceptual levels. So if you consume, 1/10 of an active dose, you might see incredible amounts of anti-inflammatory activity. I think there are some biotechs looking at this. And Jack, you and I think should do a conversation at some point in the near term around why is it that scheduling drugs actually makes science more expensive and what kind of cost savings we might see if we descheduled a lot of these molecules, and or did away with the Controlled Substances Act.
yeah,
And then how could that improve viability of biotech companies or decrease the amount of capital required by biotech to pursue a lot of these molecules? So I think there's a lot there. You got to meet a number of scientists who are really worried about their science going away because they spent their whole
yeah.
career working on these molecules, right?
One in particular, Dr. Raul Ramos, I believe, is not going to be able to continue his work researching
Hmm.
the anti-inflammatory properties of DOI, in particular at UC Berkeley, because the DEA, against science and logic and reason, of course, decided to move forward in scheduling DOI and DOC as Schedule One substances. And on that same note, 4 states have now uh, have scheduled DOI as a Schedule One substance under their state laws. One in particular being the great state of Wisconsin, where one of the scientific experts for the Ramos SSDP Ramos legal team, Joe Hennessy, friend of the show, has been actively studying DOIs anti-inflammatory properties and other applications, from my understanding. So the hindrance, not only federally funded or federally accessible research, but also a clear backlash based on the DEA's ruling at the state level already, is really concerning. And the cost of entry with the Schedule 1 license from the DEA is just incredibly higher, and makes it really difficult to scrape together funding.
Right. You need more safes, a lot longer process to get approval. And yeah, like famously, um, was it Charlie Grobe? No, who recently left us, who is the famous scientist at Hopkins? Um, Roland. Roland Griffiths. He was the right person for the job to start massive amounts of psychedelic research because he had that level of patience and persistence. And he's very, um, he was very much a odd duck at the time, but he showed people that we could do it. That said, it's a lot easier to research Tylenol than it is psilocybin right now. So,
Yeah.
especially with RFK's interests, but I think we can. That's good. So I think there's a lot left for us to do here. Like, why keep these things scheduled if it's going to hurt us in terms of not having new medicine sooner, new medicine in the broader pharmacopoeia, right?
Yeah. Yeah. Yeah.
Cool.
Oh, go ahead, Joe.
Final point, correcting myself yet again, 4HODIPT and 4OHDIPT. The number like OHHO can be flipped apparently. So it doesn't really matter. The more general name is iprocin, IPROCIN. So people can look that up. You go to the Reunion Neuroscience press release, and you'll be able to find all this data about the molecule. It's their proprietary form. They've done the somewhat standard IP protection around their molecule.
Yeah.
Cool.
One story I'd love to touch on before we wrap
Sure.
is another scandal breaking in regards to former Arizona Senator Kirsten Sinema, who has become an active and outspoken member of the more specialized ibogaine lobby, if you will. I believe even being a designated ambassador for Americans for Ibogaine. Sinema's been embroiled in a number of scandals recently, including an alienation of affection lawsuit, basically an adultery lawsuit in the state of North Carolina, from the ex-wife or soon-to-be ex-wife of her former bodyguard and apparent affair partner, Matthew Amell. I've detailed a lot of this in my recent coverage for Double Blind Magazine, but the latest scandal is that Sinema appears to have allegedly spent over north of $700,000 of campaign funds, despite no longer being a sitting member of Congress, on personal expenses, including luxury travel, concert tickets. This is pinnacle of corruption in the political sphere. And for those who might not be familiar, Kirsten Sinema is pretty unpopular in circles here in Washington on both sides of the aisle. She ran as a Democrat, ultimately aligned herself with more corporate interests, a lot of money from big pharma, a lot of money from a number of other dubious angles, kind of known for voting against minimum wage increases during the COVID-19 pandemic, in alignment with a number of diehard conservatives like Mitch McConnell of Kentucky, and has most recently, after her political career ended, really gotten involved in lobbying for AI data centers in her home state of Arizona, which remarkably has fallen flat with pretty remarkable pushback from everyday citizens. I would highlight the AI data center pushback at the state level from grassroots advocates as a highlight of what concerted, coordinated coalition building can look like in achieving real progressive goals, and I think is a telling example for the psychedelic community at large to follow. But as we wrap up here, I think it's worth noting that Americans for Ibogaine has continued to refuse to comment on whether or not they were aware of or had even vetted Kirsten Sinema for some of these PR risks, if you will, in the months leading up to her increased
This is
involvement.
based on your investigation and comms with
Yes.
Yeah.
Yes, I've reached out to them a couple of times requesting comment in relation to my coverage of her scandal, her first scandal in the alienation of affection lawsuit. Blind magazine, to no response.
Mhm.
And I can say that after speaking with half a dozen sources in the greater DC area, that Americans for Ibogaine was warned pretty repeatedly that working with Kirsten Sinema would be a risk, and seemed to ignore those warnings. I'm not sure why. I think a pretty simple Google search of her political history and her voting record can illuminate why she might be a bit problematic for the psychedelics movement to be aligned with. And again, I really think that folks that are supporting organizations like this should demand more of the organizations they're donating to, because I can say, I'm in the process of working on another piece about the political trauma surrounding Kirsten Sinema, and there are more scandals to come. And I'll leave it at that for now.
Yeah, and final comment, Josh Hardman just got back to us on this Colorado. Josh Hardman from Psychedelic Alpha just got back to us on X around this Colorado bill change for kind of prepping the ground for Comp 360, Compass's psychedelic product. And he says the bill only concerns prescription drug products. So fingers crossed it stays that way.
Yeah.
Jack, it's been good. Thank you for your time today. We'll hopefully do this a couple more times this week.
Yeah. Thank you, Joe. Have a great day, everybody.
Thanks, everybody.